Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Karnataka and Uttarakhand on alert following China pneumonia outbreak. In response to a surge in respiratory illnesses affecting children in China, the Karnataka Government Health Department has issued a statewide alert, readiness of healthcare infrastructure. This decision follows a directive from the central government urging states and union territories to promptly reaccess public health and hospital preparedness measures. The advisory underscores that while seasonal flu typically has short duration with low morbidity and mortality rates, certain vulnerable groups such as infants, the elderly, pregnant women, immunocompromised individuals, and those on long-term medications may face higher risk, necessitating hospitalizations. Preventive measures recommended in the advisory include covering the mouth and nose during coughing or sneezing, frequent hand washing, avoiding unnecessary face touching, and the use of face masks in crowded places. Simultaneously, the Uttarakhand government has issued an alert directing officials to intensify surveillance, particularly in districts sharing land borders with China. For the first time, Delhi aims to establish Center for Excellence in Transgender Health Care. AIIMS Delhi is in consultation with the Health Ministry division for setting up a dedicated center to provide comprehensive and holistic care to transgender individuals. The aim is to set up the center within the next 4 to 5 months at the Burns and Plastic Surgery block at AIIMS, said Manish Singhal, head of Department of Burns and Plastic Surgery. He also said that they are in the consultation with the National AIDS Control Organization and the Ministry of Health to establish a center of excellence for transgender health care. The Allahabad High Court has intervened in the case of a terminated medical representative holding the classification of such representatives as workmen under the Industrial Disputes Act of 1947. The medical representative employed by Nicholas Pyramid India Limited was dismissed for allegedly submitting false call reports about visiting doctors and chemists. The court in a recent judgment emphasized the classification of medical representatives as workmen post May 6, 1987 without limitations on wages or employment capacity. The respondent, initially appointed as a clerk and later as a medical representative, faced charges of misconduct for submitting false call reports from October 5 to October 18, 1996. Despite a regular inquiry, the court observed that there was no record of statements from the doctors the representative claimed to have visited. The court set aside the dismissal, stating that the findings were illegal and arbitrary due to insufficient evidence. A parliamentary panel led by BJP member Brijlal has recommended the government to consider introducing legal safeguards for healthcare workers facing violence from patients' relatives. The Parliamentary Standing Committee on Home Affairs examined proposed criminal laws, reviewed memoranda from medical associations urging the inclusion of provisions under Clause 115 of the Bharatiya Nyaya Sanhita to penalize violence against healthcare personnel. The associations highlighted the vulnerability of healthcare professionals to violent attacks when patients died during treatment. The Union Home Ministry, responding to the committee, stated that general penal provision apply to all citizens equally. The ministry emphasized the state's duty to protect all citizens, including healthcare workers, and cautioned against making specific provision for one profession as it could lead to similar demands from other professionals. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.